You're watching ManVsProstate, and once again, this week in Madrid, the International Continence Society. So much good stuff going on there right now. And on Wednesday, please attend the session on mLUTS BPH BPO to learn from tremendous leaders and defenders such as Manuela Tutolo, where she'll be talking about and sharing insights that we definitely can learn from about how long should medical treatment of LUTS be maintained in men in the era of minimally invasive prostatic surgical treatment? What a fantastic topic. And let's dive in a little bit now about what we can learn about and maybe just start thinking about in preparation. But this Wednesday, please make that session. It's going to be a great one. And so as we all talk about what are our shared goals, one is to preserve bladder health and to prevent late-stage BPH BPO. Sorry about that, my computer did that. As well as to end the polypharmacy epidemic. And we can see here stages 1, 2, 3, 4, and 5. And the goal is not to let men enter into these later stages of BPH BPO. No man wants to live with the shame and embarrassment of leaking down their leg or going into the terror of retention, or heaven forbid, a lifetime of catheters because their bladder has died. So these are all things that we work together to prevent. Men do not just want to live longer, they want to live better, chemical-free and catheter-free. And so more men are saying no to a drug-first approach. And as we learn from leader and defender Luca Zindolo from the Italian Brigade, we learned that, look, let's stop narcotizing bladders. Medications have a low compliance rate, side effects, cost, the inconvenience, and they marginally improve the situation. More so, remember, this is not just what we want, it's what our patients want. 2/3 of men on meds are not satisfied. 2/3 are looking for some alternative. Remember, drugs are not therapies. Drugs are not treatments for BPH BPO. Let us be clear, we are not anti-drug. Drugs can be solutions, like in sepsis. Antibiotics treat the problem. But for BPO BPH, deobstruction is a solution. It's a mechanical problem that merits a mechanical solution when merited. Just like a catheter, drugs are temporizing measures that buy us time to triage and obtain a bladder health baseline, along with prostate size, prostate shape, and Detrusor function, the big trifecta. We can use that for shared decision making to help find the right surgical choice for deobstruction. Important to note that medications from the ManVsProstate perspective, just like in the combat trial, yes, over that 4-year period, combination drugs reduced risk. But if you use the process of qualitative research and inductive reasoning and take this out to 10 years, we see that the risk is never eliminated for stage 4 retention or BPH surgery. Combination 1 in 10, tamsulosin 1 in 3 men will have issues. And we need to recognize that medications really are just sweeping the problem under the rug and delaying care. Well, the question becomes, is there evidence that this really happens? Well, if we look in the UK in 2018, we really tip our hat to the authors of this article, with lead author Defender Young, looking at the negative impact of drugs on bladder health. They looked at a cohort of TERPs, about 100 in 1990, 2000, 2010. And if you look at the indications and complications within that, we can now reframe the data within the 5 stages of bladder health and ask the question, do drugs increase late-stage BPH BPO? And we can see here that, as expected, with the rise of medication use from 1990 to 2010, we saw that surgeries, TERPs, decreased by 65%. And in that same time period, patients on medications rose from 2% to 43%. And as a result, in 1990, 2/3 of the time, men were having surgeries for the indication of early stage LUTS, stage 1, 2, and 3. And then over 2 decades, we see this shift where men, there's a progression to later stages where now 2/3 of men are having surgery, having already entered into the late stage 4 retention. Of more concern is we can see a 6-fold increase in the number of men who failed to void after deobstruction from 2% to 12%. And the question next is, well, maybe that's just on that one side of the Atlantic. How about on the other side of the Atlantic in other parts of the world? And we tip our hats to Defender, Izzard, and Curtis Nickel from Canada with a similar study looking back at around 305 guys who had TURP over the years from 1988, 1998, and 2008. And once again, if we look through the lens of the 5 stages of bladder health, what do we see? Very similarly, we see that in 1988, 2/3 of the men were having surgery for early stage disease, whereas 2 decades later, where the number of TURPs had decreased by 46% and the number of men on patients had increased to 87%, we see this shift again, where now you can see 43% of guys were presenting for surgery in late stage 4, and 39% potentially were in late stage 5. And so at ManVsProstate, from a community perspective, we ask to please remember that we are not just pill-pushing physicians. We are solution-finding surgeons. We are deobstructing urologists, as well as we are preventative urologists, intervening at the right time to prevent late-stage disease by deobstructing the right prostate in the right patient with the right technology at the right time. So I hope that helps a little bit. I just wanted to share some thoughts from our community-based perspective, but please, most importantly, go to this talk on Wednesday by Manuela Tutolo. Amazing leader with amazing insights. There's probably so much there we can learn. Report back. What can we learn from her that we can incorporate to our community-based approach to BPH BPO? Because clearly we're all evolving forward together so that we can all help generations of bladders of the now and of the future. All right, we'll see you guys on the next one, and take care until then. Bye.